When an infant is placed in the supine position, the positioning aids can be used to support flexed and midline orientation. Select a snuggle up, bendy bumper, and jelly donut in the appropriate size. You may additionally choose to use a Frederick T. Frog or Squish On 2 or 3. For thermally unstable patients, pre-warm the gel in an incubator, under running water, or with a warming pad. Once warm, the positioning aid will remain at the approximate temperature of the incubator or the ambient air temperature of the warmer. If using a Squish On 2 or 3, insert it into the back of the snuggle up. Cover the gel with a disposable cover before patient use. Using hand containment, hold the infant in midline flexion. Flex the infant's legs and hips deep into the pocket of the snuggle up, keeping feet, legs, and hips aligned. Continue to use hand containment, following the infant's cues. Tuck the infant deep into the snuggle up so hips are flexed, knees are in alignment with ankles, and feet are in neutral position. The head should be midline with the chin, slightly tucked, and the shoulders rounded with the hands to mouth. Keep the infant's hands at the face for self-comforting. Place boundaries, such as a bendy bumper, to maintain the neonate's extremities close to the body, with shoulders gently rounded forward and elbows in slight flexion. Flex and abduct the neonate's hips slightly. Align the legs with the trunk, with knees slightly flexed, to encourage flexion and natural resistance against the boundary device. Adjust the straps to provide containment, while also allowing for dynamic movement at the hips first, then the shoulders. Frederick T. Frog can augment the bendy bumper for support. Moving the adjustable beads creates the appropriate boundary height. It's important to remember that Frederick T. Frog is designed for weighted support, so do not place its full weight on the infant. Note that if the infant kicks their feet over the foot roll, this indicates that the infant is either not tucked deep enough into the snuggle up or needs to advance to the next size. You can also use the Frederick T. Frog to help with support. If on intraventricular hemorrhage protocol, you may add a Freddy to provide comfort and add additional support to prevent movement of the head. During phototherapy, if overhead lights are in use, twist the straps to make them smaller and minimize the amount of space they occupy, or remove them and tuck them under the snuggle up. If panel phototherapy is in use, you may turn the snuggle up around and use a bendy bumper at the feet to accommodate the cable between the panel and the light source. When positioning is used with a mechanically ventilated patient with a CPAP device, position the infant appropriately in a snuggle up, as was demonstrated in the supine positioning. If using a bendy bumper around the head and torso, ensure that it does not interfere with the tubing. A Freddy can be used to support the head in place of the bendy. Surround the head with the Freddy hands to support midline position, as well as provide a support for the CPAP tubing. 2 Freddys may be used as support for the CPAP tubing, if necessary, by laying the Freddys under the tubing to prevent the tubing from being pulled. For intubated patients, there are no special considerations to be made in the supine position.